All right. Well, welcome everyone and happy Saturday. By the way, I don't have we ever done a Saturday call? This
I
is
don't
kind of
know.
different.
Saturdays are tough for me. I know it is for everybody else too, but I thought, let's change it up a little bit. Let's mix it up. So here we are.
I love it. I absolutely love coming together with all of you guys on this live Zoom today. This is definitely something we've never done. In fact, we're in for a real treat, you guys, with Dr. Derrick DeSilva joining us live on this health symposium. Guys, grab a pen, grab a paper. If you're just joining us, you definitely want to have a pen and a paper because you're going to be doing a health check questionnaire. And by the way, this is something we've never seen before, Dr. DeSilva. We're super excited. I'm excited to see what my score is versus Tony's.
Well, I'm sure yours is going to be better than mine.
All right. Well, we do want to formally get this thing started, and we definitely want to, kick it off with introducing our Chief Medical Officer, Dr. Derrick DeSilva. You guys, just so you know, you are in for a real treat. This isn't your everyday doctor. I mean, my goodness, we didn't have enough slides to put all of your credentials on here, Dr. D, but there's a lot of things that we love about you. Number one, the fact that you've been an internist for, I think it's now 38 years. Is that correct?
Yes, yes.
38 years, you guys, still practicing today out of New Jersey. He also sees patients down in Florida and even travels around the world, you guys. He is world renowned. He actually is an educator. He travels around the United States and around the world, actually doing seminars for other physicians. So definitely well respected. Obviously, but also past president. I love this, past president of the American Nutraceutical Association. So Dr. DeSilva, even though he is obviously an expert in Western medicine, one thing that Tony and I really appreciate about you, Dr. DeSilva, is your love and your passion, for Eastern medicine, natural modalities and really helping people get to the root cause of why they're sick. And so that's what today is going to be all about, you guys, is, what is your health? What does it look like? We're going to actually score that today with a series of questions from Dr. DeSilva. But also, not only is he going to ask you questions so you know what your score is at the end of this live today, but also what to do moving forward, how to improve your health the natural way. So anyway, also on the teaching faculty of the JFK Medical Center. You guys, he is literally the recipient of one of the most prestigious awards in medicine. If you've never heard of it, it's called the Alan Mintz Award for Excellence in Clinical Age Management Medicine. My goodness, he's formulated over 400 different natural supplements. He's a radio personality. He's an author. My goodness, like I said, Dr. D, we could go on and on and on. But I think the biggest thing that I love about Dr. D is I love your heart. I absolutely love your heart and your desire to help people really feel well. And so we're super excited about today. We're going to stop the shared screen and we're going to bring you on live, Dr. D.
Great.
We
Thank you
just,
so much.
Yeah, let's hear in the chat for Dr. D, guys.
Hey, thank you so much, guys. Thank you, thank you, thank you. It's a pleasure to be here. I wanted to, as Jenny and Tony said, I wanted to mix this up a little bit, right? We didn't want to do the same old thing. It's a Saturday. I'm freezing my noogies off here in New Jersey. Yes, I was supposed to be with Jenny and Tony in person in Florida, but unfortunately it didn't happen. I want to go through. There is a list of about 38 questions.
Mhm.
When I ask the question, I will tell you to give yourself a +1 or a -1. All right. So you're starting with a clean slate, and we're going to go through these series of questions. Excuse me. As I go through these questions, I'm going to tell you why I'm asking these questions. And by the way, this is something that I just put together. Just I thought it would be fun. It would be fun to do. I did this on a plane on my last trip back from Florida. So here we go. Oh, by the way, I just got back from an international conference. Actually, it was an international conference in Miami, and there was a panel of us, and it was an aesthetics conference, but I was on the anti-aging and longevity portion of it. There was a question that was asked, and there were five of us on the panel. The question was, if you had to pick one thing, just one, that would improve longevity and optimal aging, what would it be? If you could improve one thing or do one thing, what would it be? There were five of us. Three of the people, including myself, said glucose control. And two of them, which I was shocked at, said nitric oxide production. And I'm thinking to myself, wait a second.
Mhm.
We have two products that this world panel of experts out of the three said glucose, including myself, and two said nitric oxide. And I was just blown away because when we put this company together, what Jenny and Tony said to me was, what are the top five health issues that we need to try to fix? Sugar was one. Cardiovascular disease was up there also, which is where the nitric oxide comes in. So just so that you know, this isn't just us saying this. This is a panel of experts, international experts, that are saying the same thing. Okay, so I will elaborate on that as we go through this. Okay, so here we go. Question number one. When was the last time you had a full blood evaluation? If you've had one within the past year, give yourself a +1. If not, don't do anything.
I did.
You might have earned one, Tony.
All right, Tony's got 1 point. Jenny's gonna have 40 and Tony will have... I love you guys. I love you guys. Okay, so part of this panel, and again, and I know you probably don't have the answers to all of these, but did you have your blood count checked? Did you have your thyroid checked? Did you have your cholesterol checked? Did you have your hemoglobin A1C, which is your sugar, checked? Did you have your vitamin D level checked? So those, oh, and the other thing I have on here is vitamin B12. If you, I mean, this is a fun thing, right? So you don't have to have all of them. If you had one or two of those that you know of, give yourself a +1. All right? So, number 3. If you're a young lady and you had a mammogram in the past year, give yourself a +1. If you're a man and you had a prostate blood test done, or you had the uncomfortable rectal exam done, if you had your rectal exam done, give yourself a +10. I'm joking. But if you're a man and you had your prostate checked, whether it be a rectal exam or a PSA in the past year, give yourself a +1. If you had a colonoscopy within the past 5 years, give yourself a +1. Or if you've had a Cologuard, which is the stool test that you can send away. The bottom line is here, I want to know if you've had some kind of a colon evaluation done. Give yourself a +1.
Now, Dr. D, if
Yeah.
you haven't had those done, you don't -1. You just
No,
don't.
no, you just don't add anything.
Okay, she's giving me a -1 over here. I'm like, wait a second.
Yeah,
Cut that out.
only give yourself a +1. If I say take away, then
Okay.
I'll tell you when that happens.
Okay.
Look, he couldn't wait to
And again,
start.
this is just fun. This is not an exact science, right? The point of this is there are certain things that you really need to have done that a lot of times we just overlook and we put off. So that's why I'm going through this. Okay. So number 4, have you had a physical exam by a trained professional in the past year? If you have, give yourself a +1. So you've been to the doctor, you had your blood pressure checked, you've had a checkup. Number 5, do you drink Yes, okay, that's a plus one. But no, do you drink about half your body weight in water a day? Basically, do you stay hydrated? Do you drink enough water? Do you have that water by you? Are you staying hydrated? This is one of the other things that came up during this discussion. And remember, this is an aesthetics conference and an international aesthetics conference that I was in Miami. And I can't tell you how often hydration came up when it comes to your skin, right? If do you want to be a prune or do you want to be a plum? So, a plum is something that is just hydrated, and a prune is just a dehydrated plum, essentially. So, do you want to be a prune or a plum? And the way to do it is hydration. Let's see. Cheryl says
Here.
listen, Cheryl, you're a very beautiful plum in a good way, okay? In a very good way. So, all right. So, but do you stay hydrated? Give yourself a plus one. Okay, so this is important. Number six, do you exercise at least 30 minutes a day, 4 to 5 times a week? Are you active? Are you really active? Are you doing something? And the folks down in Florida, for the people down in Florida, I once met somebody that said, by moving to Florida, I added an extra 10 years to my life,
Yep.
right? I mean, Jenny and Tony, you guys know this. There's no way, even though the sun's out, that I'm going out and freezing my butt off today. It's not happening. I'll go down to my basement, I'll get on my elliptical, I'll do something there, I'll get in the sauna, whatever. But it's so nice to be outside, and I think that's where the golf and the tennis and the pickleball and walking and all of that stuff really comes in when you're in a warm environment. So our goal is to get all of you down to Florida in the very near future, and by making the money that you can make through this wonderful company. Okay. Next, do you eat regular meals? Do you eat regularly? And are you conscious of what you're eating? I'm not talking about eating just junk, right? I mean, do you do intermittent fasting? If you do intermittent fasting, give yourself another plus one. All right. So
No.
do you eat regular meals? Plus one. Do you do intermittent fasting? Give yourself another plus one. And again, please don't get hung up on this. This is not an exact science.
What'd you say a regular meal was, Dr. D?
Are you eating 2, 3 times a day? Even though you do intermittent fasting, are you eating a good lunch? Are you eating something in between? And are you eating a good dinner? And is it healthy? Are you conscious of what the big point here, Tony, is we're not perfect. When Tony and I go out, we have our hamburger. Tony will pick me up from the airport somewhere and say, "Hey, Doc, what do you want to eat?" And I look at him and I say, "Let's go get a burger."
And Tony's always hoping that you say that.
Yeah. But that's the point, right? It's not like we're doing this every day, and it's just something that you do once in a while. But consciously, are you conscious about what you're eating? Do you prepare your meals? Do you eat those salads? Do you have the fruits and vegetables? That's kind of all I'm talking about here.
Okay.
Do you sleep at least 7 hours a night? 6 to 7, actually, it's 6 to 8 hours a night. That average is 7. Why is sleep so important? I mean, we all know that. Sleep is so critical. If you don't sleep, right? I mean, you feel awful. Who
And
wants
if
to do anything the
you
next
don't
day?
sleep, get on some progesterone too. Unless you're
I was
man.
going to leave that out of the equation,
Right.
Jenny. Okay, but
I'm fine with
yes,
sleeping, yes.
that for this whole, again, all joking aside, I was approached by a major network, and I haven't even told you guys about this, to do they're filming a documentary in Costa Rica on menopause.
Wow.
And they're bringing in, I think, 12 or 15 women, along with 4 or 5 international experts, to spend a week with these women. And I'm talking God, I don't know if I want to be with a bunch of, I mean, ugh, I might have to take Jenny with me just to kind of be my bodyguard, as we go through this. But seriously, the menopause issue is getting so much press. It is absolutely incredible, right, Jenny? How many women are suffering with this?
Mhm.
And it is just, again, sleep is one of the major issues when it comes to menopause. And ladies, if you're not sleeping and you are menopausal, do something about it. All joking aside, do something about it. And I don't mean strangle your husband. Um, let's see. Do you do, and if you sleep 6 to 8 hours, give yourself a +1. Do you do at least one good deed a day? If you do, give yourself a +1. And it could be anything. It could be holding the door for somebody. It could be letting somebody out in traffic. It could be making giving somebody a nice compliment. That is a very important piece of who we are. And a lot of you have heard me say this so many times. One good deed a day boosts your immune system by 40%. The person you do it for yourself, and everybody that witnesses it. So give yourself a +1.
So on that question, Dr. D, I do a lot of good deeds a day.
You get 1 point, Tony.
So
Okay.
do I get like a +10 on this one?
Oh my God.
You can give yourself a +10. That's fine.
Okay, good.
I'm only giving
But-
him a 1.
All
Yeah,
right.
just a one is good. I don't have the variable built in there for the +10.
Okay.
Okay. So again, another very important question here. Do you have, and this is very, very subjective, do you have a good relationship with your spouse or significant other that makes you feel cared for and loved, and you share the same emotion back with that person?
Again, you get a -1.
Why is that important? Jenny, you can give yourself a 10. And seriously, this is where cortisol, this is where insulin, and this is where stress comes in, right? I mean, yes, Kanda, I know you love your Ken. We've seen the two of you together, okay?
Jeff Ross says, ugh.
It's hilarious, Jeff.
Hey, no personal comments here, okay? We don't want to get in trouble. Come on, let's keep it clean. But again, in all seriousness, the other thing that stood out in this conference, and this was not in Miami. This was another board that I'm on, another very amazing board that I'm on. If I told you the people on this board, you'd probably fall over. But we were having a discussion about weight loss. And Jenny, I'm actually going to wait till Tony comes back because I want him to hear this too. But this whole idea of weight loss, and again, I'm going to get into this in a little bit more detail. People that have trouble losing weight also have a big issue with stress.
Yeah.
People that have belly fat, people that can't lose weight, there are two things that you have going on in your body that if you don't control, you will not lose weight. And Jenny, this is something that we have talked about, but really came to the forefront when I started talking to these folks. One of the guys said, how many of you, and he was talking about asking the question to a group of doctors. There were about 15 of us. He said, how many of you check insulin levels? And how many of you check cortisol levels in people that can't lose weight? And, I had a comment on that because just recently I have a patient. She's a lovely lady. I've known this lady forever. She came in and she said, Doc, I am doing everything and I can't lose weight. Now, she's always been a very high stress person. Recently lost her husband, God bless her and him. And I checked her insulin level and I checked her AM cortisol, morning cortisol. Her insulin level, now normal, I like to keep it around 7. I mean, I'll fudge and go up to 10. Her insulin level was 54. Her cortisol level was off the charts. So she's not going to lose, and she's not going to lose weight. And she's got a huge belly. She's got to be 220 pounds. So, I unfortunately I had to put her on some medicine because her insulin was high, her sugar was high, and her cortisol level was high. She's not going to lose weight. She's not going to lose weight. And she's lost a couple of pounds on Pure Max, but I said to her, there's something else going on. So making sure that you control, and we're going to get into this a little bit later. That's one of the questions here, by the way. Making sure that your relationships are as good as you can make them. They're stable, that you're emotionally not drained at the end of the day. Okay. I mean, Brian and Amy, another lovely couple, right? That I can see the love. We can see the love. We can see the concern. We see this in couples. So, a very important piece of your emotional well-being and your physical well-being. All right. So, if you have that good relationship, give yourself a +1. Next, do you take a probiotic every day?
Mhm.
Give yourself a +1. You better be taking a probiotic every day. Right, Jenny? Don't make me.
That's
Don't make
You're
me.
right here.
Do you take vitamin D every day?
Yes.
These are just simple givens. Do you take and are you conscious of your glucose? Do you take our glucose support every day? +1. Have you taken a supplement? This is the next question. Have you taken a supplement to cleanse your liver or even thought about a liver cleanse supplement in the past year? If you have, if you think about it right now, okay, you can't give yourself a +1 because I'm talking about it.
Did you say if you thought about taking one, or if you did?
But you know what? Let's leave the thought about out.
Okay.
Let's say, have you taken a liver cleanse in the past year? All right, give yourself a +1.
Okay.
Okay. Now, this is a biggie, and I don't know if you guys I sent these questions to Jenny and Tony. This is really something, believe it or not, that, and I'm giving away a secret here, that I do. When was the last time you spent coloring in a coloring book? Jenny's gonna go get her coloring book.
Yeah, she colors with the grandbaby, so she's probably got one she colored not too long ago.
Yes,
Hey,
yes.
this, look.
There you go. Okay, so let me add this to that, Jenny.
Yeah,
So why
wait.
did I ask that question? There's two reasons I asked that question. The reason that coloring is so amazing is because it takes you back to your childhood,
Mm.
right? Think about that. Coloring in any form. Add on to that being a grandparent. I don't know if you guys have read and seen the latest data on being a grandparent. If you are a grandparent and you spend, and I forget the exact time, but the question was significant time, meaning you see them once or twice a week. If you do spend that time with your grandchildren, you increase your longevity significantly. So, when you're with the grandkids, one of the things that we do is we color, right? I love to do that there, and to try to get boys to sit down and color, forget it. Girls will do it, the boys are tough. But seriously, if you have done that in the past year, give yourself 3 points. 3 points, because that is really significant. Have
Gloria
you
wants to know if artwork counts as coloring, doing artwork.
listen, Gloria, I don't know if you've seen, if I don't know if you've seen Gloria's artwork, but Gloria's artwork is something that she sells for a lot of money.
Wow.
Wow.
Her artwork is absolutely gorgeous. Just gorgeous. She sent me something about 2 years ago now that I still have. It was with crystals that she had pasted. Oh my God. It was absolutely beautiful. So, yes, Gloria, you can take the 3 points on that. Next question. Have you taken a vacation in the past year? Give yourself +1 if you have. Have you spoken or visited with a family member that doesn't annoy you in the past? I'm kidding. Have you spoken or visited with a family member in the past week? In the past week.
What number are you on, Dr. D?
Number
Oh, number
17.
17. Okay.
17. Yeah.
Okay.
Yeah, and there's the order is kind of mixed up. I'm going back and forth. 17.
Give us +1.
Have you spoken with or visited with a family member in the past week? Give yourself a +1. And again, it's that family interaction, right? It's that interaction with loved ones. It's the emotion. It's what you do to your immune system. Do you know your blood sugar? And that kind of goes with have you had your blood sugar checked in the past year? Do you know your blood sugar? And again, for a lot of people here at Pure V, you should know your blood sugar because we have the app and you can do the Pure Scan app. So you should know that. Do you know your vitamin D level? Are you aware of what your vitamin D level is? Remember, vitamin D is called the sunshine vitamin. Vitamin D kills bad cells in your body. Vitamin D is amazing for your
Yeah.
emotional state, seasonal affective disorders. Vitamin D. Vitamin D boosts your immune system. Vitamin D is good for your muscles. If you have weakness in your muscles, if you have an elderly person that can't get up out of a wheelchair, vitamin D will help that. Vitamin D is good for your heart. Vitamin D decreases all-cause mortality by 26% or 36%. So vitamin D is just a critical nutrient, which is actually a pro-hormone that we all need to have. Do you know your vitamin B12 level? If you know your vitamin D level, +1. Do you know your vitamin B12 level? +1 on that. Vitamin B12 is critical for what? Your brain, your heart. People with dementia have low levels of vitamin D and B12. Vitamin B12 is critical for the nervous system, all right, for those people that have neuropathies. So again, B12, really important. Do you know your level? Now, do you know your homocysteine level? I would be willing to bet that most people don't even know what homocysteine is. Homocysteine is an amino acid, and you could do a blood test for this. Homocysteine is an amino acid that if it goes up in your blood, you increase your risk for heart disease and you increase your risk for dementia. So people that have dementia, people that have cardiovascular disease, usually have elevated homocysteine levels. How do you bring your homocysteine level down? The way you bring your homocysteine level down is by taking 3 nutrients: vitamin B6, vitamin B12, and folic acid. The vitamin B12 needs to be methylcobalamin, and the folic acid needs to be methylated folate. So there was a study done by a gentleman by the name of Dr. Kilmer McCauley. Dr. Kilmer McCauley was at Harvard. He was a pathologist. And about this was our lifetime. So about in the late 50s or 60s, what he found was that there were children that were dying in their teenage years, and on autopsy, they had severe heart disease. They had blockages. So these kids were having heart attacks. He reported this in a journal, and he said the way to treat this is to take vitamin B6, vitamin B12, and folic acid. Well, guess what? Harvard fired him from the Department of Pathology and said, that's ridiculous.
Hmm.
Research was done after that at various institutions, and they realized that he was right, that the way to lower your homocysteine level was with those three nutrients. He was asked to come back to Harvard. I don't know if he did, but Dr. Kilmer McCauley is the one who found a disease state, Jenny, you might remember this, called homocystinuria. Homocystinuria, the diagnosis was made in these children's urine because they were checking for sugar, and they found very high levels of homocysteine in these kids' urine. And that's where the name comes from, homocystinuria. So homocysteine, knowing that level, folks, really important. I do that as part of my physical when I check people. All right.
Well,
So
Doctor, real quick, we have some questions here, if you don't mind. We have someone saying, can you repeat the types of folic acid? So they're just wanting you to repeat that.
it's called methylated folate.
Yep.
Just like we have methylated B12, it's methylated folate. The reason for that is because 60% of the population cannot convert regular B12 to methylated B12. They can't convert folic acid to methylated folate because that's the effective
Yeah,
form.
go ahead, Tony. And so would you just recommend everyone get on methylated? Don't even
Yes,
do methylated, because most people don't have the MTHFR. They don't get the genetic testing.
correct, correct. That's the best way to do it. And you know, when we've talked about formulations, that's what we always said, right? I
Right.
mean, you just said it right then and there. That we don't know who is and who isn't.
Do methylated. And would a B complex be providing all those different forms of vitamin B?
Yes, yes, as long as you're looking at those two nutrients, methylated B12, so it's methylcobalamin,
Mhm.
and methylated folate. It's usually called tetrahydrofolate or just methylated folate.
Methylated folate.
Yeah.
Awesome.
There you go.
All right.
Let's-
Okay. So here's where our first minus comes in.
Oh boy.
Oh boy.
Do you smoke?
Ooh.
If you smoke, minus 5 points from where you are right now. I'm just talking if you smoke now, not if you smoke before, okay? If you smoke now. Add 1 point if you don't smoke. So if you smoke now, and I'm, you know, I'm not talking about this stuff, Tony.
He's talking about smoking.
So smoking, it's just smoking tobacco, not
Just smoking tobacco. Here's
well,
why.
lucky
You
there.
know, even, I think, guys, I think we can even put vaping in there
Oh yeah.
because the dangers of vaping, I think, are also significant. Smoking THC. Again, I did a whole presentation at one of the marijuana conferences, one of the THC conferences, on the effects of smoking THC and the heart. I mean, it's worse than smoking cigarettes, believe it or not. So, a -5 if you do, and a +1 if you don't. Okay, next question. I mean, that's another whole discussion that we can have that I think is important. Have you seen a dentist in the past year and had your teeth cleaned?
Can I ask you a quick question about the tobacco real quick? Somebody said, what about cigars? You talked about vaping and tobacco, smoking tobacco, but what about cigars?
That's smoking.
So
Well,
it
somebody
is smoking, but smoking cigarettes. Smoking cigarettes has been linked to 22 different cancers. Chewing tobacco and cigars, not as many links to cancer, but the risk of oropharyngeal cancer, of mouth cancer, throat cancer, significantly increases. Okay. So the answer to that is probably yes, because again, you're increasing your risk and you're inhaling all of these nasty things. Are there any other questions, Jenny, you want me to answer?
Wait a second. Libby Brown says she had hers tested because I asked if it was elevated, but they then did B6
She's,
and it,
I think she might be referring to B12, maybe,
Yeah, right. So
or homo. Yeah, I don't know. She just
what
said,
she's asking, I know what she's asking. What she's asking is she had her B12 level tested and it was elevated. Right. So you're an over methylator, Libby, which means that your body's just, burning through this very fast. Remember, B vitamins are water soluble, right? So you can't overdose on B vitamins. You don't want to, but you really can't because again, they're water soluble. It's not like vitamin E or some like CoQ10. These are fat soluble, so you can overdose on something like vitamin E, but the B vitamins not a problem. Any other questions you want me to?
no,
no,
that
that
was
was
great.
it.
That's good.
Thank you,
Okay.
Dr.
So we'll
Okay.
finish on number 23 about dentist. Have you had
About the dentist.
Yeah.
Why is the dentist thing important, folks? The dentist issue is important because the bacteria in your mouth that cause plaque has been linked to the same plaque that is found in your arteries, in your heart. So they've done they've done bacterial analyses, excuse me, on the flora that causes plaque in your mouth and the bacteria that is found in plaque in your arteries. And guess what? It's the same bacteria. There's a direct relationship between oral health and heart health. So, what I tell people is this. Whenever, and this is my own personal thing, okay? Just so that you know. When you go to get your teeth cleaned, it is really important the day before you go that you take some vitamin C and some zinc. Why? When you get your teeth cleaned, what happens in your mouth? You bleed, right? You're bleeding. So you're damaging the gums, you're damaging the vasculature. That bacteria that is on your teeth can potentially get into your blood system. And where does blood go? It goes to the heart. So what I tell, and remember, people that used to have, Jenny, you probably remember this, right? People that had mitral valve prolapse, which was a little heart valve issue many, many years ago, what did we give them before they went to the dentist? We gave them an antibiotic. They've gotten away from that. What I tell people to do now is take some vitamin C and take some zinc before you go to get your teeth cleaned and after you come back. And I usually do it for a day before and a day or two after. Why? Just to clean out your system. Just in case there's junk floating around in your blood, why not just take that precaution? Again, I'm just being cautious because again, doesn't it make sense? Doesn't it make sense that if there's that relationship between the two, don't you want to keep that as clean as possible? For me, the answer is yes. Okay, so just a little tidbit there.
Couple questions are coming up here. What about flossing? Do we get an extra point if we floss every day? No.
I absolutely hate flossing.
Oh.
Personally.
You don't
You
have
know
the
what
right
I use?
flossers. You don't have the right ones.
No, you know what I use? I use the picks.
Uh-huh.
Yeah.
I can use the pick. I can't floss. It just drives me bananas. So, yes, if you floss or if you use the picks to clean the stuff out of your teeth, I would definitely say give yourself, let me just put that in here. Put yourself a +1. So do you floss?
And how much vitamin C do you recommend the day before and like if you're
I
going to
would do I would do a minimum of 2,000 milligrams before, and the zinc would be 25 milligrams, Jenny.
Okay.
And then the next day would be another 2 to 3,000 milligrams of vitamin C and 25 milligrams of zinc for about a day or two afterwards.
Also, what is your take on peroxide, hydrogen peroxide? I've heard
Ab
mixed reviews on that.
Absolutely, unequivocally, no.
No.
No, no.
Tell me
Do
why, because I do this.
Yeah.
Tony, I'm telling you. So when you use hydrogen peroxide in your mouth, if you use mouthwash, and you guys have heard me say this because I know I've said this before, or mouthwash, what you're doing is you're changing the flora in your mouth. And that goes for colloidal silver. I just saw colloidal silver.
Mm.
Absolutely not. If you change the flora in your mouth and you kill off all of the good bacteria by using hydrogen peroxide, Tony, or by using mouthwash, what's going to happen is you can't convert, you can't begin the process of nitric oxide production
Mm.
because nitrates are converted to nitrites in your mouth with the good bacteria.
Okay.
That then goes, the nitrites go to your stomach and they're converted to nitric oxide in your stomach. It's called the exogenous pathway of nitric oxide production, okay? Because it's also produced in the blood vessels, okay? So, no, Joe, you don't need to deal with stinky breath. What you do need to do
Brush
is
your teeth.
brush your teeth. Exactly. Brush your teeth, but don't forget to clean your gums and to clean your tongue with your toothbrush. And of course, yes, there you go, Cheryl. Brush your tongue, right? Brushing your tongue is a very important thing to do to keep very good oral health.
Yeah.
All right. And floss, of course, and floss.
And use a toothpaste that doesn't have fluoride in it. Jenny and I we actually get a toothpaste online. It's called P6, I think it is. And it actually has probiotics in the toothpaste. So it's supposed to heal your teeth, make them stronger. So
What's it called, Tony? P6?
I'll get
it's
it.
P6. It's fluoride free for one, and it's got probiotics inside of the toothpaste. So it actually is supposed to heal like cavities that you have, help rejuvenate your teeth and get rid of cavities and stuff. So
Yeah. Pete, I designed a toothpaste. I actually designed a skin line,
SP6.
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 I designed a skin line many years ago with probiotics in it for the skin, and that's coming back again. It's getting hot, but I love the idea of brushing your teeth with a probiotic. I mean, I use something called, I don't want to, it's going to take me too long to run upstairs and get it, but it's called Jason's. Jason's is the brand that I use, which is really nice, but it doesn't have probiotic in it. I love the idea of probiotic, Tony.
Yeah.
I really do. Any other questions, Jenny, you want me to do before?
Yeah, somebody says, I thought colloidal silver was good for you. It is,
It's
right?
good for you, but just not to rinse it in your mouth, right?
Yeah, no, colloidal silver is great for you, and you can rinse with it if you have a sore throat, but don't use it every day, right? You don't want to do that every day. Colloidal silver, whenever I do pellets and whenever I make the incision, when I'm closing up the incision, I use just a drop of colloidal silver on the Band-Aid on the dressing, and I put it on, and then I put the water resistant cover over that. Never had an infection. Colloidal silver is wonderful for that, but don't use it every day. Use it if you have a cold or a flu or something coming on, and then stop. All right, because you don't want to change the flora.
Perfect.
Well,
All right.
who would have thought our oral and dental care would be the hottest topic of the day?
Yeah. It's a big deal. It really is a big deal that people don't pay attention to.
Okay, where are we at on our
We
points?
are on, let's see. Oh,
24.
you want to know what your points are?
No.
Okay.
No. Okay.
We're on
Okay.
24.
So this is a tough one. About your blood sugar. If your hemoglobin A1C is less than 6, and you know what it is, give yourself a +1. If it's greater than 6,
Mhm.
-1. If it's greater than 7, -5. I'll say it again. If your hemoglobin A1C is less than 6, and if you don't know it, then no points at all. Okay. If your hemoglobin A1C is less than 6, add 1 point. If it's greater than 6, -1 point. And if it's greater than 7, -5 points. Now, why is that important? The hemoglobin A1C is what your blood sugar is over the past 120 days. The red blood cell lives for 120 days. And again, you're able to measure how much sugar is on that red blood cell over a cross section of these cells. Folks, we have two products that when an international panel of experts was asked, what are the two things, or actually, what is the one thing that you need to do to control your aging and improve longevity? 3 out of the 5, including myself, said control your blood sugar. We have an amazing, and I'm not trying to make a sales pitch here. I'm telling you what we have. We have a product that is phenomenal for sugar control. It has all of the ingredients that you need for sugar control. Use it after you have 2 meals a day, one dropper full twice a day. The other product that, excuse me, the other thing that the doctors said, and I didn't say this, was nitric oxide.
Wow.
If you have good blood flow, thus the name flow, if you've got good blood flow, you have perfusion, meaning the blood's flowing to your brain, to your eyes, to your heart, to your extremities, to your kidneys, to parts down below, to your feet. All of this has to do with blood flow, because if the blood doesn't get there, you're not getting the nutrients to where it needs to go. We have two of the most important products, according to this group of experts in our company. So glucose and flow, for those of you that are not using it, folks, you got to use it. This is a must. This is a must. Okay? All right. And I know everybody knows this. This is the next question. Do you know what grounding is? I know you all know because I've talked about it a million times. If you do know what grounding is, give yourself a +1. If you do grounding, if you've done grounding in the past year, we had our traincation, so I think everybody did grounding with us all together. Give yourself a +1. If you live in Florida, you're walking outside without shoes, you're going to the beach. That's grounding, folks. Again, the information on grounding, on stress reduction, on detoxification is wonderful. Okay. So this one is a little controversial. This is our next question. Do you have, again, I'm telling you, the data on this is getting interesting. Do you have more than 5 drinks of alcohol a week? Now, this is getting controversial because the whole idea of alcohol is kind of falling out of favor. Okay. So, again, if you have more than 5 drinks a week, now, again, what's the definition of a drink? It's not, it's not like going to an Italian party where you get a bottle when you walk in, right? I mean, that's a drink for them, but you know what I mean. Like if you do have more than 5 a week, it's a -1. If you don't, then it's a +1. All right. Again, controversial. I don't know. I don't want to get there. All right. This is the most important question in the whole 38 or 40 questions that I have.
Oh gosh.
You ready? If you are a football fan other than a Philadelphia Eagles fan, do a -10.
That is not fair.
If you're a Philadelphia Eagles fan, add +10. And you can even add another +2, just because, actually, another +10 because they won the Super Bowl. So, by the way, during the Super Bowl, Bob and Tony were texting me going, "Go Eagles, go Eagles, go Eagles." But anyway, no, that question doesn't count. But seriously, what I have here is, are you a Dallas Cowboys? And that's really for this area. If you're a Dallas Cowboys or a New York Giants fan, -10 if you are. If you're a Philadelphia Eagles fan, add 10 plus 25 points. That's what I have written here.
And then he says, just kidding on this one.
Yeah, and it says
you don't have to minus or plus.
Yeah, no, you don't have to minus anything. I'm just joking on that one. Okay.
We do have a couple quick questions here.
Sure.
Like,
I'm not answering Philadelphia Eagles questions, Jenny.
someone, Conda says, what do you think about grounding sheets, for your bed?
Yeah, you know what, Jenny? There's a gentleman by the name of Dr. Steven Sinatra. You guys might have heard me mention his name. Cardiologist, God rest his soul. He passed away about 2 years ago now. He was a huge fan of grounding sheets, grounding pads. I don't have any problem with those at all. I really think they're a good idea. I really do. Especially for us that live up here in this area, that we don't have the chance to go outside. I think it's a great idea. Yeah. There's nothing better than the earth.
Real quick, one other question. Sarah wants to know.
Somebody says, how do you cleanse your liver? I guess I would probably say stop drinking. No, I'm kidding.
No, Dr. Lusby, you're right. You're absolutely right. But the way you cleanse your liver is and again, you don't need to do this every day, right? There's glutathione, there's milk thistle, schisandra, dandelion, some of the other adaptogens. Cilantro. Cilantro is a great detox, and it's also a great cleanser. What cilantro does is that it binds heavy metals. It binds heavy metals and it takes it out of your body. Nice. B vitamins are not liver cleansers, but B vitamins, as an aside, are also very good chelating agents, meaning they grab heavy metals, they grab toxins, and they take them out of your body. That's why when you do an IV, a lot of times they have a B complex in there with vitamin C, etc. So for the liver, schisandra, milk thistle, N-acetylcysteine is okay, but glutathione, dandelion, and cilantro, and there's more.
Awesome. I got my cilantro yesterday. My cheese queso dip at the Mexican restaurant. So I'm good.
They literally did.
Oh my God. I love going out to eat with Tony. Really. Because if Jenny's not there, folks, Tony and I go crazy, right? Hey, Tony, where do you want to go? Let's go to that burger place that we really like. And if Jenny's in the car, we have to say, we'll go to that salad place.
Yeah, or something.
No, but seriously, anything else, Jenny?
No, that was it.
I think we're coming up on 54 minutes already. My goodness.
Good.
Time flies.
Okay, I'll hurry up.
No, you're good.
We're good. This is fun. I think we're on number
28.
Yep.
Okay. Another very important piece, and I know a lot of you know how I feel about this. Do you physically carry your cell phone on your body meaning your pockets, your belt, your shirt pocket, your back pocket. If you do, and don't lie about this, -1. If you don't, add 1. So if you physically carry your cell phone on your body, -1. If you don't, add 1.
Dr. D, I am so brainwashed because anytime we're out and about and I see people with their phones like up here or in their pocket, I have to really hold back from saying something,
Yeah,
you
yeah,
know,
it is.
I want to tell
When you
them.
know how dangerous it is, and
Mhm.
also the other thing we should talk about are the earbuds,
Yeah.
right?
Oh, man.
That's one thing I never see on both of you. I
Well,
never see
we went to
earbuds.
the wired. We do put wired ones in, but we got rid of our the Bluetooth
AirPods,
ones.
yeah.
Yes,
Yeah.
yes, the wired ones are the way to go. Absolutely, absolutely. Number 29. Uh, do you put your laptop on your lap? Add 1 if you don't, -1 if you do.
What if you put a thick pillow under it? Does that count?
Radiation goes through,
Oh,
Oh,
goes through.
she's
Remember,
guilty.
Jenny,
guilty of that.
these are radio waves. These are they're not radio waves, but they're waves, if you will, that go through your system, right? They're not just
Uh,
enough.
well, Dr. D, is it Jobs? Who invented the laptop? It was Steve Jobs,
Is
right?
it?
Steve Jobs.
Um,
Yeah.
I don't know.
But anyways, he's the one that created the laptop. You put it in your lap, and what he died from,
Mm,
huh?
mhm.
He died from what, prostate cancer
Yeah.
or
Well, pancreatic cancer.
pancreatic cancer.
Pancreatic
He
cancer.
always had his
Yeah.
laptop in his lap. Yeah.
Yeah. And I see people with the keyboard right on their belly
Yeah.
and the screen, and the keyboard is where all the juice is, right? I mean,
Yeah.
it's incredible. So don't do that anymore. Um, Another one. Have you ever been given a speeding ticket?
Ever or like in the last 20 years?
I don't know. I've never gotten a speeding ticket. I'm too paranoid.
What?
No. Um, well, let's say 10 years, Jenny. Let's say 10 years.
10 years.
10 years. Have you had a speeding ticket in the past 10 years? +1 if you have not.
Well, yeah, I've had two or three of them
In the last 10 years? You have?
Yeah, I've got a
Oh,
lot
see,
of them.
now I haven't had one for probably 20 years, Dr. D.
No, 10 years. 10 years.
Okay.
I get
10
that.
years.
I
So
get
see?
Do you
As I
mind?
said, we're just having fun here. Now,
Yeah.
why did I put speeding ticket on there?
I don't know. What's that got to do with health?
It has everything to do with health. It has to do with your car, your seatbelt, how fast you drive. These are all things that, if you think about your longevity, I mean, if you're driving like a maniac, your longevity is going to decrease because the chances of you getting hurt, the chances of you getting seriously injured goes up. If you don't wear a seatbelt, the chances of you getting hurt go up. Now, again, there are people who will argue with that. But statistically, for the people who drive slower, I'm not talking about driving, like your 95-year-old grandma. I'm talking about following the speed limit, five miles or so over, statistically live longer.
Oh, not only that, when you get pulled over by a cop, when you see them turn around and put their lights on, your stress level goes through the roof.
They don't have to get behind you. All you have to do is pass them at 90 miles an hour, right? Because you're immediately looking in your mirror going, oh God, did he
Yeah, I
come
hope
out?
he's going past me, not behind. Yeah.
True, true, true. True,
Okay.
true, true. Okay, so
So
la-
wait, hang on. We got Mona's asking if we can repeat the speeding ticket one.
If you have not had a speeding ticket in the last 10 years,
give
then
yourself
get a +1.
yeah. In the last 10 years, give yourself a +1. Okay.
Okay. Where are we at
Moving
now?
on here.
next one.
34.
Have you had your eyes checked by an eye doctor in the past year?
Yeah, 31.
Why are eye exams so important? Eye exams are important, folks, because eye disease, if you're diabetic and your eyes will predict early disease. In fact, I am in the process. I have a call later today with an eye doctor. We're getting ready to start a research project where eye doctors, and I think a lot of you heard me say that I'm one of the national speakers for lens crafters. In fact, I'm speaking at their conference this year in Punta Cana in the Dominican Republic in the fall. And we're going to start a project where they can look into your eyes. They have the technology to look into your eyes, the small, teeny blood vessels, and predict disease 15 years before it manifests in your body. So if you start to see disease in the back of your eye, the small blood vessels, because they're smaller than your hair, you see disease in those little teeny blood vessels, in 10 to 15 years, that disease is going to be here. Okay. And here. So again, getting an eye exam is really important. And if you've had one in the past year, give yourself a +1. Do you care? And this is a tough one. This is a really tough one. Do you care? Before that, you know, I crossed this out, and Jenny and Tony, you guys have this in front of you, and I crossed it out because I didn't want to, but the question was, do you attend weekly religious services? And the other one was, do you have intimate relations with your spouse? So I crossed those out because they're a little, if you will, taboo. But again, I don't want to point that. I don't want to give points for that. It's just something that you don't need to go to church, but a spiritual piece of you, right? That's all I'm saying. You don't have to go sit in church and, whatever, but a spiritual piece to you. That's where the good deed comes in, what I talk about. And then the other thing is the relationship, with your spouse. So let's leave those two out, but just so that you know, those are in my mix here. This next one, do you care for an elderly patient? Do you care for an elderly parent or loved one? Folks, that's a tough one. That's a tough one. That is a very, very difficult thing. My sister, my brother, and I went through it with my dad and my mom. God rest their souls, they're both deceased, but it's a very stressful time. And if you do, it's a -1. You would think it should be a +1, right? But it's very, very, very stressful. If you do, make sure you find the time for yourself. Make sure you find the time to do some grounding. Make sure you find the time to take your vitamins, your nutrients, et cetera, et cetera. Do you have a pet? Do you have a pet? Pets are very cool. I don't. I have fish. I think those are pets, I have fish. I have this beautiful fish tank in my office, and I love those guys. They've gotten really big. But if you have a pet, give yourself a +1. Very important. Do you like/love what you do in your line of work? I love what I do. I absolutely love what I do. I love doing stuff like this. If you do, and if you love what you do, give yourself a +1. Do you hug your significant other daily? Oh man, that doesn't count. That's right now.
Sometimes I have to be reminded to.
Yes.
Not very nice.
I'm kidding.
Why is that important? That is important because that hug needs to last 20 to 30 seconds. That hug becomes a very important piece of energy transfer from one to the other. Okay. So if you do +1, do you kiss? All right, don't go start making out, the two of you. Do you kiss your significant? It's like Barbie and Ken kissing each other, right? I mean, but do you kiss your significant other daily +1? And if you know, or if you're over the age of 50 and you've had a coronary calcium score, give yourself a +1. Okay?
You know what, Dr. D, real quick, I'm going to add to that because Jenny and I both have had that Karen. Oh my God, I can't say.
It's a calcium.
It's a calcium score, right?
Right, calcium.
So we went and did that. It's basically $50 and it takes less than 5 minutes.
Mhm.
But it's an important test. Everybody should have one of those.
Absolutely.
Yep.
The coronary calcium score is a CAT scan of your heart. And what it does is that it measures how much calcium, excuse the sun over here, guys.
Oh, you're fine.
It measures how much calcium is in your heart. Because if that number is really high, what that means is you may have a high calcium burden and increase your risk for heart disease. All right. So that's our last question.
Awesome.
Add everything up,
Oh boy.
and I'll give you a couple of minutes. I'll give you a minute to do that. Add those numbers up.
Feel free to drop them in the chat,
Yeah,
guys.
you guys drop when you add your
Yeah.
scores up. Don't be afraid. I'm gonna
let them know ours.
I don't know what a good score is and a bad score, but I'll tell you mine and Jenny's. Hang on one second.
This is so
Tony
fun, Dr. D. Thank you so
Is
much.
19
Sure.
This has
and
been awesome.
Jenny
Yvonne, what'd you have? 32? Okay, that's good.
30. What are you?
30.
30. Okay, there we go.
Wow.
19?
That's
Tony.
what I think she was cheating on my score over here.
No, I did not. I actually tried to give you the max here.
Rosemarie and Jeff Bladen's a 33, those two.
Wow.
Good. Tony, I think she took off 10 points for the,
I
for
think
some of
so.
those things, right? And she
Mona.
gave herself 10.
Mona Sams is a 36. Go, Mona.
Go Mona. That's awesome.
Okay, good. I like this.
I'm the lowest so far. That's not good.
CEO.
I better get my butt in gear. 31. Oh, wait. Amy's a 19 and Brian's
19?
Me and Amy are losers. We're the
Hey,
biggest
Amy,
losers.
you gotta watch that husband of yours.
I love it. Awesome. Let's see.
Debbie Peacock's 23, 26,
Okay.
22 for Conda.
Joe is 19. What was Marsan?
Joe is 19. Marcian's 18.
18.
Oh, wait. We
Marcian.
got a biggest loser. We got another big loser.
Hey, Joe, you gotta
Oh.
stop hanging out with Tony, man.
I
Stop
know,
already.
right?
That's hilarious.
So Marcian so far is the lowest.
Oh boy.
If you
Oh,
Wait,
boy.
Jeff Ross says he's a few kisses below 20. Oh my goodness. You guys are awesome.
I love it. I love it. I love it. Okay, so
This is awesome. All right. They're still coming in.
Dan's
okay.
God, I didn't want to be alone at 19.
Yeah, you didn't
It's
want to
good.
be the only one that low.
All right, 24, Sue Crouch is a 24. All right, so I guess you're going to give us, I guess, Dr. D, you're going to give us a good score and you're going to give us a bad score, right? And tell us what
Well,
maybe.
you know what? I all I'm trying to do here is, and Jenny, maybe what we can do is post this online if you
Oh,
want
yeah.
to do that,
Absolutely.
right? So people could kind of look at it. And look, all I'm trying to do, yes. So Joe, you're absolutely right. Checkups should be more of a priority. You're absolutely right. That's exactly my point. And this is not dependent on a number, guys, okay? All I was trying to do here was to raise your level of consciousness. I'm not telling you good, bad, or indifferent. Obviously, if that number is a little bit lower, okay, you need to get a checkup. You need to know your homocysteine level. You need to start using your glucose. You need to make sure you're taking your vitamin D. You need to get a checkup, all right? And I think that's the point, and Joe very well said. Jack, exactly. Use this as a baseline to try to improve your health. And folks, we can come out with products. We can come out with everything. There's two things you have to do. One, you have to pay attention. And number two, you have to use them. As I said before, when I heard and please excuse me for being redundant here. When I heard those international experts saying those two things, I immediately said sugar. I didn't even think about it, right? I immediately said sugar. When I heard out of the five, three said sugar, two said nitric oxide, I thought, oh my God, I wish Jenny and Tony were here to hear this. And I wish everybody from Pure V were here to hear this. We have a great glucose product. We have a phenomenal nitric oxide product. We have a vitamin D. We have a vitamin D with K2. I'm speaking on vitamin K2 alone. I'm doing a 45-minute lecture at an anti-aging conference in April just on vitamin K2. We have a D3K2, let alone the technology, Cheryl. You're absolutely right. We have the probiotic. We have this, we have the mushroom formula. We have everything that you need to improve your health. The message here is use what we have. Don't go try to invent other things. Use what you have. Put it to the test. Every single one of you should be using all of these products. And if you scored a little bit low, go get a checkup and just be safe, be careful, and God bless all of you.
Let me give, I am going to give some scores out. Like Dr. D said, you guys, this is,
Stop it.
yeah, let's stop the recording real quick.
We're going to go ahead and stop it, guys. Thank you so much for being a part of this
Don't
live.
go anywhere because I'm going to
And,
give you, I'm going to give you the numbers, and then so you kind of know where you fit in there. Can I do that, Dr.
Yeah.
D?
Yeah, again, Tony, yeah, go ahead. I mean,
The numbers are just, yeah. The numbers are just saying, hey, look, be more aware. If you've got a low number, maybe just go get a checkup, right? But the perfect scores are from 37 to 40 points. A good score is 28 to 37 points. And anything below
25
a 25 or below,
is not good.
maybe change a few things.
I put pay attention.
Pay attention. Yes, just pay attention. Yep. So, anyways, Dr. D, thank you so much. That was so much fun.
Yeah, thank you so
And
much.
actually, and I got something out of it today. I rinse my mouth with I don't use mouthwash because I know that's not good for you. So I usually just use peroxide. So I'm throwing that away and I will not use it anymore.
Mhm. It's just not a good idea. Good.
Thank you again,
All right.
Dr. D. We're going to go ahead and stop the recording.